Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us once again. Our guest is Dr. Sheldon Kardener. He's a UCLA professor of psychiatry. He's a patient who received the very first procedure inserting Abbott's next generation version of the MitraClip heart valve repair device here in the United States. And he's joining us here today to talk about his experience with this groundbreaking device. Welcome to the program, Dr. Kardener.
Thank you very much.
Well, as I said, you are a UCLA professor of psychiatry and the first patient to receive this MitraClip heart valve. How and when were you diagnosed with mitral regurgitation, and did you understand what it was when you were diagnosed?
Well, certainly I understood because I am a physician, although it's not my area of expertise, but I was diagnosed with having a mitral valve murmur. I can't quite recall. It must be 20, maybe 30 years ago. And that murmur has simply always been part of the physical finding when I've had physical exams. But it's generally went from, yes, we can detect it, to, wow, that's pretty severe. And it's gone over, as I say, it's progressed slowly but definitely. So it's hard to date the onset. But I would guess it could be 30 years or more, yeah.
Going from we can detect that to, wow, that's pretty major, were there any symptoms looking back that you experienced that maybe you missed or could have closer attention to?
Well, there's no question that a fatigue was setting in, and gradually again, and thought perhaps it was related to work schedule, etc., but also a dyspnea. That was the major symptom that was disconcerting, and I often would walk to my office to get some exercise and found that my breathing pattern was more consistent with having jogged than walked. So I could do it, but again, was kind of panting as if I had jogged. And so the tiredness and the dyspnea were the major symptoms that were increasing.
How did you hear about this MitraClip procedure?
Well, because of the dyspnea, the reasonable question was, is it pulmonary or is it cardiac? And well, I suspected it was primarily cardiac. It was for other reasons. I had had a middle lobe infection a couple of years ago, and so it was reasonable to follow up and see what the status of that, make sure it was all healed and well. So I consulted with a pulmonologist, and he heard me with my shortness of breath in speaking, and he said, your lungs are clear, they're fine. You really ought to see Dr. Carr. And I said, what for? And he said, because of repairing the mitral valve. And I said, I've wrestled with that for a while, but I hate to have my chest cracked. I just was not looking forward to that. And he said, no, Dr. Carr does a procedure through the vein, the femoral vein, and feeds into the heart. And so I was intrigued. I then spoke with my cardiologist, and independently, in thinking about it, and we had discussed the possibilities before, but again, my hesitancy was the major surgery that would be involved. And he said, well, I don't know, you ought to get evaluated, and why don't you see Dr. Carr? So it's ideal when you get two personal physicians triangulate on a referral independently, and they did indeed with Dr. Carr. So I saw him, and he felt very enthusiastic about the likelihood of a good outcome, and that the procedure would be this process through the femoral artery rather than cracking the chest.
It allowed you to return home a lot earlier than you expected, or did you expect the short recovery time? Tell me about the procedure and your personal recovery.
Well, the procedure was on a early morning, and by that afternoon, I was feeling fit and fine. They, of course, for safety reasons, they wanted to monitor overnight. but otherwise planned to discharge me on the next morning. And I felt perfectly fine. I felt some improvement in speech without the shortness of breath, and generally felt very good. There were no problems in terms of the post-procedure recovery at all. The only aspect that sort of came at us unexpectedly was during the night. I got very little sleep. Now that people might ask, well, nobody expects to get any sleep in a hospital overnight. But the reason I didn't, aside from it being a hospital, was that the monitor was going off all night. And in fact, when they came in the next morning, they said, doctor, you need a pacemaker. And that afternoon, they put in a pacemaker, so I went home the next day. But the procedure itself I was ready to go right afterwards. Of course, wisdom prevailed in terms of them asking that I certainly stay overnight. And it turned out to be fortuitous because the monitor again indicated a secondary issue, and that got taken care of at the same time. So it was a 2-day stay compared to what would have been otherwise.
So as far as managing since the procedure, has your recovery gotten progressively better? Are you feeling progressively better? Have there been any setbacks or anything like that? Any other side effects? I mean, you've had two surgeries, 2 devices implanted in the same 24-hour period, it seems. So how have things been since?
Yeah, very well. And I did have a 1-month follow-up echocardiogram, and it demonstrated that the valve is absolutely competent. There is almost no leakage whatever, and certainly my physical symptoms correlate with that, or the absence of physical symptoms. I have steadily felt greater strength, and I'm anxious to get back to exercising. The heat wave we're currently experiencing in this area has made it imprudent to consider getting out and doing much out in the heat. So as soon as it cools off some, I'm going to be out doing what I like to do, and that's going for a good walk as exercise. But certainly feeling far more rested and comfortable and alert and energized, as well as not having that shortness of breath.
Going from not being able to walk to your office as you previously could to considering exercise, especially when it cools down, on your doctor's recommendation, do you feel even more confident to get out there and maybe do a little bit more than you were doing before the procedure?
Good brisk walking is something I'm looking forward to resuming, and that I could do a while ago. As I said, this slowly increasing symptomatology because the valve was getting worse. And one of the most stunning things I've always, if I saw a new physician or if I had a physician whom I've not seen in a while check with a stethoscope, there was a very classic, profound mitral valve murmur. And it was a kick to have my cardiologist listen, and there's no murmur. And indeed, the murmur is gone, and all that was associated with the symptoms of that regurgitation is gone.
Would you say, being a prime candidate for this type of procedure, what would you say to someone else who's dealing with a mitral regurgitation, such as yourself, about considering the MitraClip system?
Well, I think it certainly worked profoundly well, and I think the issue is a perfect marriage, if you would, between advanced technology and the equipment associated with that, coupled with clinical skill. I think clinical skill without the technology, or technology without the clinical skill, leaves a less than satisfied situation. So I have a perfect combination of good, current, best available technology in the clip and superb clinical skill in Dr. Carr.
Wishing you continued recovery and great success, Dr. Kardener.
Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this show are available at hpr.fm and healthprofessionalradio.com.au. Subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm.